Good, happy Saturday morning, April 25th, 2020. I'm Riley King, and welcome to the Riley King Newscast right here on the Riley King Network. We have a lot of news to get to this Saturday morning, so let's begin. First up, 2 more deaths linked to COVID-19 in New Hampshire. Governor extends state of emergency order. Community-based transmission continues to grow in state. Let's take a listen to that video from WMUR News 9.
These are truly challenging times, but New Hampshire companies are here and open for business.
One thing the coronavirus is teaching us all is how much we value having a safe place to stay and be with our loved ones. If your safe haven is ready for a new roof, call Queen City Roofing for a no-obligation free estimate. We are a certified Master Elite roofing contractor. Protect your home with a new roof from Queen City Roofing. Call us today or visit us at queencityroofingnh.com.
We're stronger when we stand together. Help keep New Hampshire businesses and our communities strong.
And tonight, 2 more deaths in the state connected to COVID-19 as Governor Sununu extends the state of emergency in New Hampshire. Good evening, everyone. I'm Tom Griffith.
And I'm Jean Mackin. This is not an extension of the stay-at-home order. It continues the state of emergency that requires a renewal every 3 weeks.
But as he announces that extension, we are also learning that some popular parts of the National Forest in New Hampshire are closing.
Those closures include several trailheads, day-use areas, and recreation facilities. Other areas of the White Mountain National Forest are still open. Rangers say crowds are getting too big for people to keep a safe distance, and some are ignoring guidelines.
And so the changes come as New Hampshire's number of cases grows again. The state now has more than 1,000 current confirmed cases of COVID-19. There have been more than 1,700 known cases since the outbreak began, and there are 53 deaths connected to the virus. 578 people have recovered.
Tonight, the U.S. has more than 50,000 deaths from more than 884,000 known cases. 81,000 people have recovered. Worldwide, there are more than 2.7 million confirmed cases.
Okay, and there you go on that video and that report. Now let's take a look at your COVID-19 information in New Hampshire, what you need to know. And here is what you need to know. There are 1,720 number of people in New Hampshire have tested positive for COVID-19. There are 889,661 number of people in the United States who have tested positive. 53 number of deaths from COVID-19 in New Hampshire. 224 number of people who have been hospitalized with COVID-19 in New Hampshire. And 50,890 number of deaths from COVID-19 in the United States. This map of New Hampshire shows you where the cases of COVID-19 are in New Hampshire, in the towns and cities of New Hampshire. Sandwich, 1 to 4 cases of COVID-19. This chart here, new cases each day in New Hampshire. In the purple, daily new positive COVID-19 cases. In the orange, new hospitalizations, and in the deaths are red. Why don't the numbers add up? And here is why. Current cases. In the purple, total COVID-19 cases, and in the orange, current hospitalizations. And cumulative totals. In the purple, total positive COVID-19 cases. In the orange, total hospitalizations. In the red, deaths. And in the blue, recovered. This chart here shows age group. People that have COVID-19 by age groups. Sex, female and male people who have it females and males, and risk information. This chart here shows race/ethnicity of cases and percent of New Hampshire population of cases. Your common symptoms: fever, lack of smell, cough, and difficult breathing. How it spreads, and prevention tips. Again, be sure to stay with the Riley King Network for the latest of your COVID-19 information. Officials shut down several White Mountain National Forest trailheads. Officials cite unseasonably high number of visitors to forest, raising potential of spread of COVID-19. Let's take a listen to that video from WMUR News 9, Tim Callery.
These are truly challenging times, but New Hampshire companies are here and open for business.
During these times of uncertainty,
Forest officials say they've seen unseasonably high numbers of visitors in recent weeks.
large amount of cars and vehicles in parking areas and groups of people congregating in these parking lots.
And that's causing concern over the possible spread of COVID-19 on the trails.
And we can only imagine what was going on up the trails as far as people crossing lanes with each other as they're going opposite directions.
To prevent that kind of interaction as much as possible, the White Mountain National Forest is shutting down several high-use trailheads, day-use areas, and dispersed recreation facilities.
We felt that as part of our duty to not only protect the safety and health of our employees on the forest, but also the local communities.
Parking at the trailheads and on most roads is prohibited, but visitors who can walk to the trails are able to use them. The closures will remain in effect until Governor Sununu lifts his stay-at-home order.
We didn't take this lightly. It took a lot of time to go and approach this, and some long days and long conversations amongst the forest leadership team to come to this decision.
And now the White Mountain National Forest has provided an interactive map showing which trailheads are closed. You can find that over on our website and in our mobile app. For WMUR, I'm Tim Callery.
Okay, and there you go on that video and that report. $196 new coronavirus deaths in Massachusetts. More than 4,946 new cases in state. Massachusetts Department of Public Health confirmed 196 new COVID-19 related deaths across the state Friday, bringing the state's total to 2,556. The total number confirmed COVID-19 cases rose to 50,969 after 4,946 new cases were reported by state health officials. And now let's take a listen to this video from WCVB Boston.
Virus still has a strong on our state, and that means the streets will remain quiet for a while.
And for the foreseeable future, we're going to be doing the same thing to stop the spread of the virus.
But the city of Boston is trying to help restaurants pull through, now allowing them to start selling groceries.
Blackjack Pasta is like a one-stop shop right now.
For Blackjack Pasta in the South End, it means along with their meals, they'll also be able to sell their ingredients.
Vegetables, meats,
dairy. We can give them pastas.
It could be a lifeline for some struggling restaurants, and it could ease the burden on grocery stores. For now, state and city leaders will continue to look at testing as they consider when to let more businesses reopen.
The hard and fast answer is going to be in the trend data. And I can't predict what the trend data is going to say over the course of the next 5, 6, or 7 days.
If we can do this for a few more weeks here, we will get around the curve.
So officials are going to be looking at that testing data over the next few days. Still tonight, no official decision on whether to extend these restrictions.
Okay, and there you go on that video and that report. Maine Department of Labor to expedite decision on thousands of unemployment claims. The Maine Department of Labor announced Friday that it will streamline and expedite decision on thousands of outstanding unemployment claims in the state. Labor Commissioner said this will affect 18,000 to 20,000 unemployment claims that would typically require a fact-finding interview. Fact-finding interviewers are scheduled when an initial claim requires review by unemployment staff or more information is needed before a determination about eligibility can be made, Labor Commissioner said. With the backlog of claims, Labor Commissioner said that process would have taken months to complete. Labor Commissioner said, as part of the expediting process, about 5,000 claims that were likely to be approved after an interview will be approved without an interview, so benefits can be delivered. About 7,000 claims awaiting for an interview that would have likely been denied due to the claim not meeting mandatory eligibility requirements will be denied, a necessary step to ensure these claimants can take further action without delay. Labor Commissioner said the remainder of the claims will stay and will still have fact-finding interviews on expediting schedule. Also, the Labor Commissioner said the Department of Labor is developing a new web portal where people can apply for the Pandemic Unemployment Assistance Fund. Many people not eligible for state unemployment are likely eligible for federal Pandemic Unemployment Assistance Program, Labor Commissioner said. This includes many who are self-employed. She said timeline for the new web portal will be announced early next week. The Department of Labor recommends that people file their claims online using a computer as opposed to a smartphone if possible. The department has also implemented an alphabetical call-in schedule to help reduce phone line congestion and to manage capacity to receive and process claims. Claimants with last names beginning with A through H should call on Monday, I to Q on Tuesday, and R to Z on Wednesday. Thursday and Friday are available for those who miss their alphabetical day or need to call at that time. As the department continues to expedite the number of people taking calls, the call-in hours have been extended to 8 a.m. to 3 p.m. Those who are unable to contact with claim representatives by calling 1-800-593-7660 before 3 p.m. Monday through Friday should submit a message at www.maine.gov/labor/contact. Could rapid saliva tests be COVID-19 testing breakthrough? Let's take a listen to that video from ABC News.
As some states take steps to reopen, the race is on to ramp up testing for coronavirus across the country. Since late January, more than 4.6 million total tests have been performed, but some experts say more than 5 million tests per day are really needed to safely reopen the economy by summer. Tonight, Devin Dwyer takes a closer look at a new type of COVID-19 test that some scientists say could be seen as a bridge to nationwide screening.
Some scientists are calling it a COVID testing breakthrough, a supervised but self-administered test for coronavirus from a sample of your saliva. Experts say if done properly, it could be as effective and much easier to perform than those intrusive nasal swabs by medical workers covered in PPE.
If you think about the opportunity around saliva, it can change the game. It's low risk. It's a different set of supplies that are needed.
ABC News got an inside look at one new oral fluid coronavirus testing lab in the nation's capital, a facility funded by the U.S. Air Force to test thousands of military personnel. Biotech startup Curative flying in the equipment from California, setting up the lab to test saliva samples in 24 hours or less.
That lab will be scaling to 50,000 tests per day of capacity over the next few weeks.
Right now, the military conducts less than 50,000 tests per week. The Defense Department calling the $13 million project a risk reduction alternative to nasal swab testing and potentially game-changing.
We have the ability to expand our testing capabilities to wider military populations, prioritizing the highest risk to forces and ensuring our strategic mission assurance.
If it's successful, experts say widespread oral fluid testing could greatly improve surveillance of the coronavirus across the U.S.
So we really have to change the toolkit, and that's where we really need enough testing, tracing, and supported isolation to control the disease so that we don't see resurgences.
So take the swab out of the packet.
We took the test to try for ourselves.
Now cough into your elbow deeply 3 times.
Coughing into the arm to release fluid from the lungs into the mouth, then swabbing the mouth for 20 seconds.
Make sure you're collecting all the places you might have some virus.
The swab goes into a tube of preservative and then sealed in a bag for transport to the lab. The test must be supervised by a clinician, but with proper social distance does not require extensive PPE.
There is work to be done to really confirm whether this approach is going to work well for the asymptomatic population. But as sort of a general availability of testing to have deeper knowledge into who has been infected, that will only help us in our fight against COVID.
Saliva testing is already being deployed in New Jersey, where Rutgers University has partnered with private healthcare firms to roll out the kits at hospitals and drive-through testing locations. While authorized by the FDA, the accuracy of self-collected saliva tests in general is still under review. In one study from UCLA, oral fluid and nasal swab specimens performed similarly when detecting COVID-19. But a third of infected individuals who swabbed their mouths without clinical supervision registered false negatives.
So this isn't foolproof.
No test is. I mean, we can't even get people to wash their hands for 20 seconds. It's not that easy.
But still showing enormous promise.
This may be a long-term model for how we could scale up a return to work effort across the country.
For ABC News Live, I'm Devin Dwyer in Washington.
Hi. Okay, and there you go on that video and that report. And thank you for watching this morning edition of the Riley King Newscast right here on the Riley King Network. Have a great rest of your day, and I'll see you back here later on today for another newscast. Goodbye, everyone.